Emy Cua, and this is Mugshots Now, a modern digital Filipino media platform. Watch life from a new perspective, bringing a new flavor of fun, a new revolution of entertainment, giving you our best shot. As the expert, health is a state of body, wellness is a state of being by Jay Stanford. Mga ka-mugshots, welcome to MugPahaba ng Buhay every Tuesday at 6 p.m. Please follow us on Twitter, Instagram, Facebook, and YouTube. Ang episode natin today ay tungkol sa male infertility. At ang ating makakasama today ay ang ating co-host na si Dino Lee. He's also a host of For the Love of the Game. Hi, Dino!
Hi, Doc Emy. It's a pleasure being here with you dito sa MugPahaba ng Buhay. And I'm pretty much excited for the topic today, no? Na hindi mo pa... kasi syempre coming from my perspective, you only get to find out about it when plan mo na talaga magka-anak, diba? So I'm pretty excited to have our conversation sa experts natin.
Yeah, okay. Actually, I'm so excited also to introduce today kung sino ang ating guests because aside from they're both my classmates in med school and also in residency training. And now they're very much accomplished and they trained actually both in urology and male infertility from the Philippine General Hospital. So I would like to introduce to you Dr. Sylvia Alip, who's based in Seoul, South Korea right now, and Dr. Joshua Yabut, based here in Manila, MQC. Hi, Via. Hi, Josh.
Hello. Hi, Emmy. Hi, Tino. And hello sa mga kamugshots natin who are tuned in to us today. So thank you for inviting us because it's really timely and a taboo topic that's not often discussed in our age group talaga. So it's nice that there's an opportunity for relatively younger people to ask the questions they want to hear the answers to. So I'm excited and looking forward to the questions I'm going to be answering today. Joshua.
Hi, Emmy. Hi, Dino. And it's a pleasure being here. And sana sa expertise namin, sana marami kaming matulungan at masagot ng mga clarifications, especially nga ngayon na GCQ, ECQ, marami ang gustong magka-baby niyan sa mga pamilya. So hopefully, mas matlinawan yung mga viewers natin ngayon. Thank you.
Yeah, ayan. Hi to everybody. And now I think we have to start our discussion na. Actually, when I started this, nung nag-ipon talaga ako ng questions from everybody na nahiya pa silang tanongin. Okay, so for our first question po, how will you know kung baog ka?
Sige, ako mag-a-answer niyan. Well, ang infertility ng male, syempre, is characterized siya na difficulty to conceive with a partner. Pero may timeline yan. For if 1 year na kayo nagtatry and hindi pa rin makabuo ng baby, I think it's the best time for a male and his partner to be examined. So kailangan natin magpagawa ng mga screening tests and further laboratory tests para ma-check kung sino yung infertile. Pwede kasi yung male or yung female or pwede sila pareho. No? So, paano ba ginagawa yung screening for infertility? Ang pinaka-basic dyan is seminalysis, which is done twice. Kailangan meron tayong 2 na consecutive seminalysis results na nagpapakita na poor ang ating sperm quality. So, ano bang sinasabi ko with poor quality? Siyempre, sa seminalysis ng male, meron tayong ilang parameters na tinitingnan. Yung sperm concentration, yung sperm motility, tsaka yung sperm morphology. So, iba't iba kasi yung effects niya. If one or all of those factors are unfavorable, pwede nating masabing infertile yung person.
Wow. So, yun nga sinasabi mo, it's really about analyzing the sperm, di ba? Parang you had the term earlier. Na-curious ako, are there signs and symptoms na can indicate if someone, especially like me, I'm male, di ba? So parang, is there a way for me to find out infertile ba ako na hindi ko kailangan pa-analyze ng sperm quality?
Actually, realistically speaking, di ba, when yung mga males, una nila malalaman siya sa seminalisis. So parang mabibigla sila. They didn't think na they're actually infertile. So when you look at what symptoms can present in these patients, iba-iba yan. Una sa genitals or sa ang pinaka-important, which is yung testes. So sa testicles ng male, normally ang symptoms that would show infertility is yung small testes. Ang normal na size ng testes would be around 15 to 20 ml in a male of a reproductive age group, or that would translate to mga 5 centimeters na length. So normally, pag small testes, isa yan sa mga indications of infertility. Secondly, yung tinatawag nating undescended testes or yung cryptorchidism. Kunyari, nung baby ka, sinabi sa'yo nung parent mo na, dati hindi bumaba yung testes mo or yung testicles mo. Isa din yun sa mga pwedeng symptoms na mapapaisip ka na, baka that's why we're having difficulty trying. Thirdly naman is yung mga problem with the penile shaft. So sometimes yung opening niya hindi nasa sa tip, may mga ganun eh. So pwede din yung cause ng infertility, ng sexual dysfunction. So lastly is yung mga signs ng hormonal imbalance in a male, katulad ng gynecomastia or yung mga males na biglang nagkaka-breast tissue. Sometimes yung pattern ng hair distribution din sa male, kapag kakaiba siya from normal, it can indicate a hormonal imbalance that usually comes with yung infertility. But these things, more of yung doctor na will identify in you. Kasi it's normally really the test that na the patient show na yun yung first sign nila of infertility.
So meaning you, Doc, kapag kunyari parang nasa overweight side po yung male, ibig sabihin mas higher chance siya na mas decrease ang infertility niya, ang fertility niya.
Yung you mean obesity? When
yes.
Okay, there are studies that indicate that obesity or problems with metabolism can also lead to infertility. Although it's not porket obese ka, you're automatically infertile kasi it's always multifactorial, madaming factors dyan. So, but it is indicated na in studies, it's associated with higher infertility rates.
Okay, so bali po, di ba you said, malalaman nyo talaga yung about sa fertility, depende dun sa sperm analysis, ganon. So, may parang yung sperm analysis ba siya, affected ba siya like with sex or yung frequency nila na magka-sexual activity? Does it affect the sperm analysis result?
Okay. Sige. For that, tanda natin na ang pag-produce ng sperm, which is ang term niya spermatogenesis, nag-occur siya sa lalaki in 64 days para ma-complete yung pag-produce ng mature sperm. So although araw-araw na produce 64 days ang kailangan para maging mature yung sperm. So, kasi naproproduce yung sperm sa testes, then napupunta sa epididymis para mag-mature. Ang sperm quality kasi na tinitignan natin sa seminalisis, yan yung quality ng sperm na lalabas sa ejaculate ng male, no? Sa studies, ang nakita nila, ang quality ng ejaculate ay nagpipeak after 1 to 2 days of abstinence. Then, after kahit mag-abstain pa ng mas matagal, parang wala nang improvement. Actually, nagde-decline na yung quality ng sperm. So, kaya ina-advise nga sa mga couples na kung gusto talaga nila magkaanak, yung frequency ng sexual intercourse ay pwedeng every day or every other day para yung optimum quality ng sperm, yung possible na makabuntis.
Every other day, no? Dapat may gap, hindi pwedeng everyday kasi yung sperm quality bababa. Correct? Yeah. Correct ba? Just to clarify lang.
Every other day, and dapat magko-coincide ito dun sa week ng ovulation ng female. So male and female na factors talaga ang i-consider para makabuo ng baby.
Okay. But you have to consider yung timing din ng female side.
Yes.
Since kailangan fertile din siya at the same time. Grabe, ino-note ko yun ha, single pa tayo pero we have to take note of those things kasi syempre, ayaw naman natin yung di makabuo. But ako, single ako, and for those younger men, parang ano ba yung nagko-cause ng infertility sa amin? Kasi hindi naman namin yan napag-uusapan, bro, ano ka ba? Baog ka ba or hindi? Di ba? Normally, yun yung lokohan ng sa mga friends natin. Tapos may sinasabi nila, pag talon ka daw ng talon, tapos hindi ka daw legit ba yun? Parang, yun kasi yung lagi sinasabi, huwag ka talon ng talon, tapos kailangan magsuot ka ng protection, di ba? Parang when you do sports activities kasi daw baka mabaog ka or parang pag nasipa yung yung testis mo, di ba? Or di ba yung pag natamaan, di ba? Parang nakakabaog ba talaga yun? Gusto ko lang i-clarify para lang ma-confirm kung legit ba talaga yun or not. Pero gusto sumagot.
Actually, in younger males, pwedeng cause yung trauma na tinatawag natin. So, pag, kunyari, nasipa yung testis mo, tapos nagkaroon ka ng hematoma doon na nag-cause ng ischemia or kawalan ng blood supply, pwede talaga siyang mag-cause. Pero these are rare causes and mga extreme trauma na talaga, like, kunyari, natuhog yung testicles mo, ganun. But in young males, ang common cause talaga would be insidious, like infection. Sometimes kasi hindi mo pa iniisip like, sige, you're sexually active, you're not being safe, you're not being careful, tapos magkakaroon ka ng infection. So pag multiple times of infection, pwede magkaroon ng scarring dun sa genitourinary system mo na will manifest eventually na pag nagpa-plan ka na for your family. So isang cause yun, yung infection is really quite common and it's really ignored kasi nga yung effect niya will be years later pa. Secondly, if you're a young person who unfortunately has cancer, yung mga chemotherapy agents or these drugs can also cause infertility. That's why later Josh will be telling you paano i-address yung infertility if you're a cancer patient. Thirdly, yung mga environmental toxins na mahilig yung mga younger people like smoking can also really cause problems with fertility later on.
Yeah, actually, hindi lang naman sa online, but sometimes I hear yung mga male friends ko, they're talking about yung mga supplements, like, or some are taking like maybe Viagra, mga tongkat, mga ginseng. Ano ba yung mga yon na supplements? So they really help.
Actually, yung mga tongkat or ginseng, they're not proven to help in people with fertility problems. So, kunyari, may problem ka na to begin with and you're already been deemed infertile, these supplements have no evidence to show that they're effective. Sa Viagra naman and Cialis, syempre, if you have problems with erectile dysfunction, these meds are safe. You can take them, they'll help you perform better sexually, and they don't affect fertility. Lastly naman, yung mga supplements. Basta remember lang that overall health is the goal. So try and be healthy. Be healthy as a person, keep a regular exercise and a regular diet. Because the infertility or the problem of fertility is multifactorial. So it's a reflection din of your overall health.
Correct. So hindi siya yung supplements, they just impact performance but they don't impact fertility,
yeah.
'di ba? Yung
Viagra and Cialis, kasi kailangan yung difference ng sexual dysfunction versus infertility, magkaiba yon. So sometimes may mga problems with erection and ejaculatory dysfunction. Doon talagang nakakatulong, proven, ang sildenafil or Viagra and Cialis to help with erectile dysfunction and libido. Pero they won't directly affect yung fertility. But they help indirectly by helping you, have sex with your partner.
Okay, got it. Speaking of having sex with the partner, na-curious ako kasi syempre, 'di ba, there are different types of sexual positions there. Na ano yung pinaka-effective? Meron bang gano'n na may position that is effective for pregnancy when you want to have a kid? Kasi based on syempre nag-aral din tayo niyan, nag-research tayo. Mas effective daw pag nasa taas yung guy. Correct ba? Hindi ko alam kung tama. Baka mali yung assumption natin.
Sa ibang research,
So-
sa ibang website ka ata napad.
Ano naman,
tayo.
'di ba, para masabi nating effective yung pregnancy, syempre dapat mag-meet yung sperm cell at egg cell. So
Yes.
pinaka-important diyan, dapat ma-deposit ng maayos yung semen ng lalaki dun sa sa vagina ng female. So ang sabi nila, yung may mga positions daw na nag-o-offer ng deeper penetration, so yung proximity nung tip ng penis mo dun sa cervix ng babae ay mas malaki, deeper yung penetration, so mas maikli yung kailangang i-travel na distance ng sperm. So yung mga positions daw na advisable ay either yung missionary or pwede din yung dog style. So yung mga positions na yun yung mas malalim yung maaabot ng penis ng lalaki.
Okay.
So easier na makabuntis.
Ayan. At least clear lang, di ba? Kung gusto mo magka-baby, it's either missionary or dog style ang gagawin.
Pero pwede naman kahit anong position. Depende na din sa preference ng mag-asawa.
Okay. Mas effective lang yung
Mas effective lang talaga
based on
yung
studies.
mga yan.
Dr. Ravia, may i-add ka pa bang positions apart from sa sinabi?
I think as long as you and your partner are comfortable with your vis-a-vis your sexual preference, better for you to have it in the proper frequency, which is one day or every other day.
Okay. So, yung next question ko is, may meds ba that can affect fertility? Kasi syempre, not everybody is really, walang ibang sakit. Di ba? Some people, may mga iniinom na gamot, tapos sabihin nila, ay, nung nag-start akong mag-inom nitong gamot, parang feeling ko na baog ako, ganun. May meds ba na nag-a-affect nun?
Actually, meron talaga, 'di ba? Ang sinasabi nga is all meds have side effects, and the most common medications that affect fertility is number 1, chemotherapy. Yun talaga. That's why it's really important to discuss sperm banking or fertility preservation with your doctor before you start chemotherapy. Secondly, yung mga antidepressants. So if you're diagnosed with depression and you're taking antidepressants, they can also cause fertility problems by increasing the hormone prolactin in your hormonal axis. So thirdly, papasok na yung mga hormonal treatments. Kunyari, you're having it for other diseases, or you're self-medicating, God forbid, with anabolic steroids or sports steroids, pwede din yun maka-affect. And lastly, if you're taking thyroid drugs, you can also it can also affect your fertility. But the more important thing to remember is that when you see na ay baka it's causing my fertility problems, don't stop taking the medication. What you do is you have a conversation first with your doctor. Kasi most of these medications, chemotherapy, antidepressants, hormonal drugs are still life-saving. So, syempre, priority yung life ng patient. So, wag bigla-biglang ititigil. Talk to your doctor first. Like, Doc, what should I do? Kasi I read na baka may problem with fertility. Or, Doc, I wanna sperm bank first before I start the meds. Which is pwede naman talaga. So, yun lang.
Yeah. Is that permanent or temporary, yung effects?
Some of the medications are temporary. Like most of the drugs, when you stop taking them, in a few months' time, seminal parameters or the parameters in your semen analysis can improve. While some naman are more permanent, like radiation or chemotherapy are more spermatotoxic. So that's why yung sperm banking is really discussed with cancer patients.
Oh, okay. I see.
Okay, thank you, Doc. And our next question is actually super interesting. Does wearing tight briefs or loose boxer affect infertility? So that question, we'll leave it hanging and we'll answer it when we come back.
Ayan, and we're back here at MugPahaba ng Buhay with me, Dino, and si Doc Emy Cua. And of course, our topic for tonight is something that's very relevant for a lot of the male population, no? Directly involves the male population, which is male infertility. And we have here yung guest experts natin na si Dr. Joshua Yabut and at the same time si Dr. Sylvia Alip, who's joining us from South Korea, all the way from South Korea. And earlier on, before we took a break, yung question natin was, does wearing tight briefs or loose boxers affect infertility? So yan, babalikan natin yung ngayon. So, mga doc, ano bang sagot dyan? To clarify.
Okay, sige. Konting scientific info lang. Yung sa males, iba, ang purpose kasi ng scrotum natin, siya yung nag-hold ng testis natin outside of the body, diba? So, ang ginagawa niya, binababa niya yung temperature ng testis around 2 to 4 degrees lower than the actual body temperature. So, yung temperature na yun, at the lower temperature, dun optimal yung production and development ng mature na sperm. So, yung wearing of what type of underwear, kasi it's a question of comfort and support, di ba? So, yung iba mas comfortable sila pag loose yung underwear. Pero pag loose naman yung underwear, kunyari boxers, wala namang support for the testes. So, it's a balance between the two. Kasi kunwari, regarding yung support, no? Kung hindi maayos yung support natin sa testes natin, mas prone ito to trauma. And gaya nga sabi ni Dr. Villa kanina, kapag nagka-trauma, especially yung mga younger population natin, kapag natamaan or nabugbog, actually may isa pang type ng trauma, yung testicular torsion ang tawag, napipilipit yung testis at nai-impede yung blood flow. Pag ganon, yun kasi yung mga instances na since reduce ang blood flow sa testis, pwedeng ma-impair ang production ng sperm, ng semen. Pangalawa, may mga studies na nagko-compare kunwari kung ano bang type of underwear or kung ano ang kunwari sitting position man lang ng lalaki, tinitingnan nila kung open legs, cross legs, may effect ba ito sa scrotal temperature? Actually merong effect, no? Although yung in the end naman yung ibang studies kahit ma-expose ka sa yung mga occupational hazards, yung mga males natin na nag-work sa mga factories, yung exposed sa, kunyari yung mga drivers, di ba? Na matagal sila nakaupo sa mainit na chair. Or yung iba, may mga studies pa on office workers na naka-laptop. Yung heat from the laptop and the radiation from the laptop naka-affect daw sa temperature sa scrotum. Pero in the end naman, nakita nila parang wala namang negative effect sa quality ng sperm on seminal analysis. So in the end, I think it's up to the person kung anong preference niya, kung gusto niyang masikip or hindi. As long as comfortable siya and ma-reduce yung trauma to the testes. I think kahit boxers or briefs, walang kaso.
Okay. Whether it's a tight brief or a loose boxer, it really depends on the comfort of the person. Yes. Or the male or the...
And it does not affect na fertility.
It does not affect fertility.
Okay.
How about stress? Does it affect fertility?
Actually, iba-iba yung types ng stress, di ba? Yung normal stress na naiisip natin, yung stress sa work or yung anxiety, it has not been shown to have a strong correlation with infertility. Pero syempre, keep in mind, these are studies lang. Kumbaga, hindi pa na-document na may 1:1 or a strong correlation between stress and infertility. But of course, stress can affect fertility indirectly, such as the relationship of the couple. If you're having problems at home, that will obviously redound to, lesser sex or lesser chance at, copulation. So yun yung mga indirect factors. Pero hindi pa na-document yung actual 1:1 relationship in the studies. But also I'd like to talk about yung isang type of stress na scientific or yung tinatawag na oxidative stress. na syempre, these are, it plays a central role in the quality of the sperm, the function, and the integrity of the sperm. Ano ba yung oxidative stress? Yung oxidative stress, it's generally associated with poor lifestyle or smoking, environmental exposure to smoke, yung mga ganong lifestyle can cause, DNA problems in your sperm. So yun naman yung microscopic or oxidative stress that really affects infertility. So madami talagang factors na kailangan isipin.
So stress indirectly affects infertility. Now what about kasi syempre very parang common topic yung pag-gain ng weight and having a bad diet. Like, does it really affect infertility? Nakakaano ba yan?
Kanina na touch up na yan ni Via sa sa isang question earlier. Pero sige, expound ko na lang ulit ngayon. So yung pag-gain ng weight or yung bad diet, sige, discuss na natin yung obesity, for example, no? Yung obesity, yung sobrang taas ng BMI mo for your height, actually. So napansin nila in obese persons, mas mababa daw yung concentration ng testosterone. Yung testosterone is the male hormone. Syempre, yung testosterone, siya yung primarily nag-a-affect dun sa production ng mature sperm, ng normal na functional mature sperm. Nakita nila with obese patients, yung testosterone nila kasi naka-convert into another enzyme, which is estradiol na mas marami din sa kanila. So, pwedeng isang factor yon, which is the hormonal factor, the low testosterone. Pangalawa naman, may ibang studies naman na tumitingin dun sa quality ng sperm, which was attributed to a higher BMI. Higher BMI, obese, yun nga, sa weight gain dahil din sa pangit na pagkain. Nakita nila na doon sa quality ng sperm, mas mababa yung motility, yung forward progression ba ng mga sperm. Gaya na sinabi ko kanina sa seminalysis, iba't ibang factors yung tinitignan. So isa doon yung sperm motility. So kung hindi motile or hindi gumagalaw ng maayos yung mga sperm, hindi siya makakaabot sa egg cell, hindi sila makakabuntis. So dalawa yon, yung hormonal factor tsaka yung functional factor ng mga sperm natin. Yun yung parang negative effects ng bad diet and gaining weight.
Yeah. So actually, yung little boys, diba? Kasi I often hear this in school when I was little. They really like compare the sizes of their penis and they really make fun of each other in the CR. Siguro si Dino natatawa siya, meron siguro ma-experience ng ganito. And so the question is, the size of the penis, does it really affect fertility?
Okay, the answer to that is a resounding no. The size of the penis does not affect infertility. But it's a no with a caveat. Syempre may population who have congenital defects talaga. Like people who are born with a congenital problem in their penises. Yon sometimes can affect fertility. Like if it's, it's abnormally curved, or for example, the hole or the urethral meatus is not in the tip, it's elsewhere, those can really affect fertility. Pero these are far off na yung mga may congenital anomaly patients. For patients without congenital anomalies, the size of the penis does not affect infertility.
Oh, okay. Pero pag maliit kasi, di ba mas mahaba yung travel nung
Yes, mas mahaba yung ita-travel. Although kasi, dapat yung traversion nung sperm in the female genital tract is quite doable. If your sperm function is okay naman, masa-survive niya yung travel. So you can have a small penis, but if your fertility or if your semen factors are normal, then it's not going to be a problem.
Mas may advantage lang siguro yung mas little distance.
They showed talaga na in studies, hindi talaga siya nag-observe.
Okay. Now when it comes to parang abs, di ba kanina parang yung yung kanina we were talking about the frequency, like sabi ni Dr. Joshua was kailangan na every other day para ma-maximize yung potency of the sperms, di ba? Now, by abstaining from actually having sex, does it affect my infertility? Kasi parang pag wala ka ng practice, nawawala yung mo, 'di ba? Yung effectiveness mo, like sa basketball, ganun it happens na parang hindi ka naglaro. Ang hirap na ulit mag-shooting. Like ganun din ba sa when it comes to abstaining from sex?
Well, fortunately, walang effect sa fertility and abstinence. No? Kasi naman, ang sperm production naman natin continuous naman yan. Sabi ko nga kanina, every 2 months nagpo-produce tayo. Every day nagpo-produce tayo ng bagong sperm, yung mga lalaki, no? And namamature sila every 2 months. So kung hindi man lalabas yung sperm, hindi ma-ejaculate, ma-degrade din sila and ma-reabsorb din siya ng katawan. So walang negative effect sa katawan kapag hindi nagsa-sex or hindi nag-ejaculate. Kasi as long as yung quality mo na mag-produce ng magagandang normal sperm ay nandyan at wala namang ibang other factors na mag-i-impede sa normal production ng sperm, ay kung ano yung sperm quality mo sa start, yun pa rin ang ang quality mo as long as you're in the reproductive age, no? So okay lang hindi masama na mag-abstain for the other group of viewers natin na nag-abstain.
Yeah, di ba kasi there are a lot of people naman, syempre, some people really have vices, di ba sabi yung kanina, smoking does affect fertility. And I was just wondering kung drinking also affects fertility.
Okay, so
alcohol intake.
Yung smoking, established na yun. So that's number 1. Smoking really does lead to harmful effects on your semen parameters. And just as a side note, they can find improvement in your semen analysis mga 3 months after smoking. So you have to have smoking cessation for 3 months. Doon pa lang mag-start mag-improve yung parameters. A second point on smoking is that yung maternal smoking can also lead to infertility problems later on para dun sa baby niya. So, syempre, if you're pregnant, you're not supposed to be smoking. And lastly, on alcohol naman, no? So, moderate alcohol consumption does not adversely affect fertility. So, moderate alcohol consumption is 2 drinks or less per day. Pero syempre, iba-ibang details yon depende on what you drink. But greater than 2 drinks per day or heavy and chronic alcohol consumption reduces your testosterone level. So it does affect your fertility. So if you want to
Ano ba yung 2 drinks?
Ano
ba yung 2 drinks, Doc? Ano yung 2 drinks? 2 bote? Dalawang bote ba yun?
50 ml normally of wine. But there's different measures. It's wine, beer, or whiskey. It depends. So you have to check yung alcoholic content and the volume of what you're drinking. But if you're out, just to be safe, if you're really concerned about your fertility, keeping within 2 or less drinks would not affect your fertility. And if you have more than 2 drinks naman, and if it's daily and it's heavy and it's chronic, that can surely affect your fertility by reducing your hormone or yung testosterone.
But nare-reverse ba yon? Like when you stop smoking, di ba? It improves. When you stop drinking ba, does it also
so
improve?
If you stop your alcohol consumption, mag-i-improve naman yon over a period of the 64 days that it takes for your body to replenish your sperm. So yung sa smoking lang, medyo mas matagal kasi talagang teratogenic at saka madami ng problems. Environmental toxin talaga yung smoking eh.
Ayan. Uso pa naman ng inuman ngayon, di ba?
Oh.
Yan ang galawan ng mga tao ngayon during this pandemic. But when it comes to ang sabi kasi nila, like for women, dapat maaga magpakasal because it's harder to conceive when you grow older. What about for men, 'di ba? As you grow older ba mas nagiging lesser yung pagiging fertile natin as men?
In a way, tama pa rin 'yon, no? Kasi gaya nga ng sabi natin kanina, yung sperm production natin is determined by the testosterone in the body, no? So, as we grow older, edi bumababa din yung hormones natin sa mga males, mas mababa ang testosterone nila pagtanda. Pangalawa, yung sperm production kasi natin continuous yan everyday no? So, as we grow older, I think yung quality ng sperm, I mean yung spermatogenesis mismo, mas magiging impaired siya kumpara nung mas bata yung person. Kasi sige, example lang. Ang sperm cells kasi natin galing yan sa isang cell lang na nag-divide ng marami, di ba? Mm-hmm. So, yung as that cell divides more and more, I mean, mas mataas yung chance ng mutations, yung DNA quality ng cells na yon, pwedeng mas mababa compared kaysa nung mas bata pa yung person. So, in a way, mas hindi maganda yung quality ng sperm pag mas matanda na. Pero that doesn't mean na kahit matanda na yung lalaki, hindi na siya makakabuntis. Kahit as long as merong sperm na mature na sperm na makamit dun sa egg cell, makakabuntis yung lalaki.
Meron bang pwedeng gawin para like ako example, as men grow older, like for me, meron ba akong pwedeng gawin that doesn't substantially impair yung fertility ko? Ano bang mga pwedeng gawin?
Well, actually, yung dyan, maintain a healthy lifestyle, no? So, iiwasan mo nga yung mga sinabi ni Doc Via kanina, yung excessive alcohol, yung smoking, exposure to environmental toxins, kasi as you grow old, expected naman na talaga magde-decline yung quality. Pero, mas maganda pa rin yung quality ng sperm mo kung if you live a healthy lifestyle compared to others na exposed sa ganong mga spermatotoxic agents.
Yan. Healthy lifestyle ang susunod.
Yes.
Yeah, I have a question lang kasi syempre sa practice ko, I see a lot of cancer patients and sometimes parang I'm also guilty na parang because I'm thinking a lot about yung mga life-saving treatment nila na talagang minsan nakakalimutan ko na yung about their concerns sa fertility. I was just wondering kung ano kaya yung ma-offer ko to male patients who have concerns sa in preserving their fertility during their chemo treatment or yung ibang mga treatment po na for cancer patients.
For that, syempre, magandang topic yan kasi ngayon pa lang din nagiging advocacy ng mga surgeons at mga oncologists, no? Since ang focus natin sa treating cancer patients ay yung life talaga ng patient, no? So, hindi natin pwedeng i-withdraw ang treatment sa kanila just to preserve their fertility, no? So, ano yung mga pwede nating i-offer? Siyempre, pinaka-simple, yung sperm banking, no? Pwede tayong mag-collect. May mga centers, dito, actually meron sa Philippines, na pwedeng mag-collect and mag-store ng sperm ng patients prior to starting their chemotherapy or radiation or surgery. Then, kapag gusto na nung couple na magkaanak, pwede sila mag-in vitro fertilization para makabuo sila ng baby. And actually may pwede yung gawin for adults. Actually pwede din siya for pediatric population. Although kailangan ng consent ng ng caregiver kasi mag-extract ng sperm for them for the kids. Pwede yon. Ang isa pang option, actually yung bago lang ay yung tissue banking. Mag-harvest especially ito for younger patients, mag-harvest ng tissues galing sa testis nila prior to the treatment, tapos isa-store lang yon. Then after ng treatment, i-graft back yung tissue para to hope na mag-induce pa rin ng normal na sperm production yung patient even after his treatment. Yung mga centers na to, available naman siya dito sa Philippines and actually kailangan ng multidisciplinary na approach in treating cancer patients kasi ayaw naman natin na ma-prevent or ma-hinder sila magkaroon ng baby just because nag-undergo ng treatment yung couple, di ba? Or yung male na patient natin, di ba?
Yan. So, I'm so sure na ang daming natutunan yung netizens natin and marami silang questions. So, for now, we will answer all their questions after the break.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face Body Laser Center, Andy Passion Eyebrow Embroidery.
Hello mga ka-mugshots! Welcome back to our talk tonight here in MugPahaba ng Buhay. It's all about male infertility, and we have with us Dino Lee from For the Love of the Game, who was our co-host tonight. And tonight, sasagutin na po ni Dr. Sylvia Alip and Dr. Josh Yabut lahat ng questions ng ating netizens.
Okay, thank you, Doc Emy. Of course, meron tayong mga katanungan from our netizens, no, that they were curious around certain things. And isa nga dito ay si Robert, who's from Pasay. Ang sabi niya, my wife keeps having sex with me all the time, di ba? So parang siguro most likely every day or a lot of times in a day. Parang feel niya overused daw siya. I'm overused. Will it make me infertile?
So, Robert, congratulations that you're getting lots of it in the pandemic. Lucky for you, and sana lahat ganon. But the answer to that question is no, it won't make you infertile. Actually, like Josh said, every day or every other day, sexual intercourse with your partner will lead to the best outcomes or the highest likelihood of conceiving a child. In connection to that, kasi marami din nagtatanong, if excessive masturbation or if I keep, masturbating, does it make me infertile? And the answer to that is also no. So as long as you have sex with your partner, masturbation is not going to make you infertile.
Ayan. So, Robert, sana all. Yun na lang. Sabi ni Doktora. Kasi si Doktora is far away from home right now. Nasa South Korea siya, di ba? And ito naman, another question from Eric, no, who's from Mandaluyong. Ang tanong niya is, sinabi niya, I used to be a drug addict. Does it affect my fertility? I think napag-usapan na rin yan. Baka you can expound on that, mga doc.
Okay, thank you for that question, no? Actually, ang masasagot ko dyan, it depends on the type of drug, no? Kasi iba-iba yung effects nila. Pwedeng immediate, pwedeng reversible, iba permanent. So, punta muna tayo sa mga permanent effects, no? Yung mga drugs, kunwari, mga cancer drugs, chemotherapeutic agents, yun, spermatotoxic kasi yun. So, kung nag-receive sila ng ganong treatment dati, pwedeng permanent ang impairment ng sperm production. Pero kunwari, recreational drugs, yung mga marijuana, ganyan. Yung component ng marijuana kasi, ang effects niya, nag-lower sila ng testosterone sa system natin. And yung lowering effect niya, dose-dependent and duration-dependent naman yon. So, depende kung gaano kataas yung exposure mo dun sa drug prior, pwedeng mas delayed ang effect sa iyo. Although, yung mga most types of drugs used for recreation nga ay reversible naman ang effect. Although, hindi ibig sabihin na pag stop mo na siya, immediately babalik sa normal yung sperm production mo. It could take months, 3, yung iba at most 12 months pa bago magkaroon ng normalization ng semen parameters. May ibang drugs din, kunwari yung mga opioids, yung mga pain relievers, opiates, ganyan. Indirectly, nakaka-affect din sila ng testosterone production. So, kung nag-take ka ng matagal ng ganito nung previously, pwedeng delayed din yung effect ng normalization ng semen function mo. And lastly, yung iba, yung mga anabolic steroids, tsaka yung testosterone injections, directly nakaka-lower din sila ng serum testosterone production natin. So, all in all, yung mga drugs na yan, ang general effect nila, pinapababa nila yung testosterone ng mga guys. So, yung sperm production ng mga nagtitake nito dati, mas mababa din. So, pero, pag matagal ka nag-stop ng taking ng drugs na yon, and with recovery, siguro months to a year, I think babalik din ang normal semen parameters mo.
Okay. So the effect isn't permanent, it's actually temporary. But it will take time. Hindi agad pag nag-stop ka automatic. Pagkatapos tapos na. Pwede na, okay na ulit. Ito last question from Francis who's from Quezon City. I think nasagot na rin to eh. Pero siguro if you guys wanna add anything else, feel free to do so, mga doc. Using performance-enhancing drugs, I think ang ina-assume niya dito is, yun nga yung tinatawag nilang PED or steroids, will it actually reduce my fertility? If ever you wanna add. Kasi I think merong temporary effect. Meron pa ba kayong gustong i-add around that?
Actually, yung steroid abuse or yung exogenous testosterone or yung self-medicating with sports steroids will really cause a decline in fertility. So it's really harmful if you take it na, especially if it's not for a disease, you just wanna bulk up, ganon, or you're trying to gain muscle, it will cause, yun talaga yung payoff na, a decline in fertility, among other problems pa that are medical. So the timeline is after stopping the steroid abuse in 6 to 12 months, babalik na yung adequate sperm numbers mo. But that's just, sa microscopic. After 6 to 12 months, babalik na yung sperm counts mo. Iba pa yung time for you to conceive a child. So like Josh said, mahaba-haba talaga siya. Babalik pa lang yung sperm mo, tapos magta-try kayo ng partner mo. So yun, it's gonna take you a while if you stop after you inject exogenous testosterone.
Okay, thank you very much to Dino, our co-host today, and of course kay Dr. Sylvia Alip and Dr. Josh Yabut. So, Doc Via and Doc Josh, do you have last messages for our netizens?
For me, as a final message, parang obviously, madami pang questions tayong hindi na-answer. I'm sure you have lots of questions. The thing you have to remember is always consult your doctor. Like, even if you feel na ano ba tong question ko, medyo nakakahiya. Doctors are really more open than you think. So, mapapaisip din sila and they will do their best to answer your question. So, if you have questions, don't hesitate to ask your doctor.
Sa akin naman, regarding fertility, always think of it as a multifactorial problem. So, hindi lang siya male factor, may female factor. So, it is really important that for a couple who wants to conceive a child, na pareho sila yung magpa-test, hindi lang yung lalaki or yung babae lang. Para ma-address lahat ng issues na pwedeng present sa kanila pareho.
Okay, thank you po, doctors.
Thank you.
Dino, marami ka bang natutunan today?
Of course, may mga tanong tayo na hindi natin na sasagot, pero nasagot nila doc. But of course, on kumbaga deeper details, I think mas maganda i-consult na lang siya kasi hindi na natin matatakil. Haba yung usapan natin. Pero uso na ngayon, 'di ba, mga doc, yung yung online consultation, 'di ba? Parang 'di ba, it's already applicable during this pandemic, especially for people na yun yung nakita ko parang if hindi ka convenient to go outside right now, especially if you haven't got the vaccine for COVID. So parang I would suggest siguro, and do you suggest ba na mag-online consultation na lang sila?
Yes, of course.
Yeah, I think
telemedicine advocated din by DOH. Actually, DOH really gives you yung mga websites na pwedeng puntahan for free treatment. If you don't want to spend for treatment, there are free clinics from DOH to address your concern. At saka si Emmy, ite-text nyo lang si Emmy or yung message.
Okay, thanks so much, Dino. Do you have a message for our netizens?
Yun lang, continue to educate yourselves around, kasi important yung health and at the same time, if you plan to have a family, which I think a lot of people have in mind naman, whether they're single or they're new into a relationship right now, it's really about educating yourself. And ang dami namang resources, ang daming magagaling na doctors out there here in the Philippines that can help us when it comes to conceiving a child and checking in on our fertility. So, yun.
Thank you, everybody. Thank you, everyone, for your time. And sana next time na i-invite po kayo ulit, ay available po kayo ulit dahil I'm sure ang dami-daming tanong ng ating netizens. Ask the experts. Health is a state of body and wellness is a state of being. Thank you mga ka-mugshots and see you every Tuesday at 6 p.m. Ako si Doc Emy Cua and dito lang sa Mugshots Now, magpahaba ng buhay. Follow us on Facebook, Twitter, Instagram, and YouTube. Keep safe and God bless everybody.
Special thanks to Nagit Escorel Dental Clinic, Dermacare, Face, Body, Laser Center, Andy Passion, Eyebrow Embroidery,